Hi, my name is Megan and I'm an accredited exercise physiologist and have been for the past 9 years working for Vision Health in Toowoomba. Today we're going to be talking about how we can support pelvic health through exercise for those with endometriosis. Today I have 3 tips for you to assist with this. The first is for those who are trying to build or maintain an exercise routine or those that are struggling to know where to start. Due to the cyclical nature of endometriosis, as well as the flares that can occur, it is important to have an exercise routine that is adaptable. This allows you to work your body in an appropriate way without adding too much stress, which can lead to worsening symptoms. This also leads to a cycle of increased exercise and then no exercise at all, which we call sort of like a boom and bust cycle. So making sure that you're working within your limits can help to assist with that. So the reason that this can happen is because pain is a common symptom for those with endometriosis, especially pelvic pain, which is a result of either lesions, scar tissue, tight muscles, inflammation, or a combination of all of those. As a result, this chronic pain can cause changes within the brain, increasing your sensitivity in your central nervous system. This means that flares can be triggered more easily or more frequently with less stimuli. It is seen that the right level of exercise and that appropriate exercise for you can help to minimize the structural changes within the brain, reducing sensitivity and helping you reduce pain long term. Exercise has also been seen to reduce inflammation by increasing anti-inflammatory cells within the body. So finding a good balance between exercise training load and recovery can help you to achieve this. There's a lot of research out discouraging a few certain types of exercises for those with endometriosis, and these are impact exercises such as box jumps, any type of jumping or skipping, heavy weight training, so things where you're lifting a substantial amount of weight or having to use a Valsalva technique, and certain type of core exercises such as sit-ups or crunches. However, this doesn't always apply to everyone. Some people can complete these exercises and have no concerns with them, and it doesn't cause any increase in symptoms. However, if you have had some time off or do notice that these exercises do affect you, then limiting these can help to reduce your pelvic pain, or you might like to cycle them through during certain types within your menstrual cycle, which we'll discuss shortly. If you aren't currently exercising, these exercises should be limited initially, again, because we don't know how your body is going to respond to exercise, and we want to start to create a positive experience with exercise so we don't end up in a bit of a boom-bust cycle, which is where you get motivated to exercise, have a flare-up or something happens that creates more discomfort for you, and then you cease exercise and we continue to cycle through this. This is where it's good to have an exercise physiologist within your allied health team so that you can discuss what's best for you, when to start increasing things, or how to combat some of those provocative exercises that you might enjoy doing. The reason that these exercises are discouraged is because they use a lot or place a lot of strain on your abdominal muscles and pelvic floor muscles. And as many people with endometriosis can have overactivity through their pelvic floor or increased tension through their pelvic floor, this can lead to an increase in pelvic pain. So as a result, we want to be mindful of this, not leading straight into this, but we can build up to these exercises, especially if this is something that you would like to do. And it's just deciding what is best for your body and weighing up the pros and cons of this. As I mentioned, we could cycle some of these exercises throughout your menstrual cycle, and using the changes in hormones and energy levels to help to tolerate these a little bit better. So there are 4 stages within your menstrual cycle, or 4 phases. The first one is menstruation. So that 5 to 7 days of bleeding, we tend to have lower energy levels, and this is usually where your pain or fatigue or other endometriosis symptoms will be a little bit more prominent. As a result, we want to make sure that we're doing lower intensity exercises so we're not adding more pressure to the body and potentially increasing the amount of inflammation within the system. So exercises such as low intensity cardio, walking, swimming, light cycling are encouraged, as well as yoga and gentle Pilates. During ovulation, the end of menstruation and into ovulation, our energy levels do tend to increase, and this is where we can ramp up our exercise training. So we can do that higher intensity exercise training. So HIIT training, things like F40, CrossFit, if those are things that you enjoy. You could do higher intensity cardiovascular exercise as well, things like running, dancing, boxing, as well as those heavier weights as well. If you do experience bloating or ovulation pain during that 3 to 5 day window of ovulation, you might try to reduce your intensity of exercise during this period. Again, just to be mindful of the inflammation process within the body when you are exercising. After ovulation and in the lead up to menstruation, we might see a reduction in energy levels again because of those changes in hormones. And so this is where we might start to reduce the frequency or the intensity of exercise and add in a little bit more of that lower intensity cardio, a bit more stretching, and prioritizing recovery a little bit more. By being mindful about the type of exercises that you're doing and working within your limits, this can help to reduce the amount of pelvic pain that you experience throughout exercise and create a more positive relationship with exercise. So keep this in mind if you are trying to develop a routine or if you're struggling to maintain your exercise and wonder why you don't feel as strong or have as much energy throughout the month. My second tip is to ensure that you are recovering appropriately, as mentioned above. So this is where these are really important during your menstruation phase, as well as you're coming into or the week before menstruation. So stretching is a really good way to improve your recovery and should be a regular part of your routine. It also helps to improve your posture and mobility, which can make exercise a little bit easier and move more freely through certain positions. People with endometriosis can experience postural changes as a result of pain, which can cause stiffness throughout the body and create a shortening through the muscles in your front line, so through your pec, through your abdominals, and a lengthening through your muscles, especially those in your upper back. This can make achieving full range of motion a little bit more challenging, and this can reduce function in day-to-day life. Those with endometriosis are also at a higher risk of having an overactive pelvic floor, and research has stated that this can occur in up to 45% of those with endometriosis. Stretches, specifically pelvic stretches, can help to reduce the tension throughout the pelvic floor and lead to less pelvic pain and reduction in spasms if you experience those. Stretching is a really good way to do something positive and do some good movement without having to do a high intensity exercise, especially if you aren't feeling up to doing that. It also allows you to maintain a good routine so that you don't end up in that boom bust cycle. Developing a stretching routine that feels good can take a little bit of trial and error, as anything can, and finding what areas are short and tight for you that need to be targeted over other areas. The important thing to remember with this is that we don't need to do prolonged stretching. We're looking for slight discomfort within the muscles, not pain when we're stretching. So only holding for 20 to 40 seconds to start off with, or only as long as tolerated. This just ensures that we're getting the benefits from stretching and not creating the opposite response where the muscles might spasm and shorten, creating further issues. Hip stretches, chest openers, thoracic mobility exercises are all a really good place to start. But as I said, it's important to have a look at what your posture is like and addressing those specific areas of concern for you. Quendo and Pelvic Pain Foundation have some really good stretches that you can access online that demonstrate these exercises for you and have specific pelvic pain exercises. So this can be a really good place to start if you are unsure. Otherwise, engaging with an exercise physiologist or a women's health physio can help to provide you with appropriate stretches and ensure that you're doing the right thing for your body and helping to reduce your pelvic pain. As I said, stretching is very important but often forgotten about. But if we do this along with your exercises, then this is going to help improve your overall movement and well-being as well. My third and final tip to support pelvic health through exercise is breathing. Many people probably wouldn't think about breathing as an exercise or something that can be beneficial, but breathing alone can elicit amazing benefits, especially when dealing with chronic pain, as it affects your body on a whole heap of different levels. It can affect where you hold tension in your body, it increases stress levels, and can impact your mental health. Simple breathing exercises can be a great tool to reduce the impact that endometriosis has on your body. Practicing mindful breathing or diaphragmatic breathing can help to reduce cortisol levels by stimulating the parasympathetic nervous system, which is your rest and digest. So it helps get you into a state of relaxation. This can help reset your system and take you out of that fight or flight mode. This reduces the stress the body is under, which in turn can reduce inflammation and even improve immune function. Endometriosis is characterized by a high inflammatory condition. So if we can assist with reducing inflammation through simple breathing exercises, it can help with pain management and helping to reduce symptoms. Deep breathing is seen to cause an immediate release in endorphins, which are chemicals within the brain that make you feel better and help you reduce pain. So again, if you're not in a good routine or you're struggling to do regular exercise because it causes discomfort, or you're just not in a position where you feel capable of doing exercise at the moment, then breathing can be a really good introduction to creating a routine and gaining some really positive benefits, such as reducing tension, improving immune function, and in improving mental health as well. If you struggle with sleep, then breathing can help with this as well, and so can meditation, as it gets you into that rest and digest, which can give you better quality sleep. Yoga Nidra, which we'll talk about as well, is a good option for those that like a more guided option and elicits the same improvements in health. A few different methods for deep breathing that can be tailored to where you're at and what suits you best. The main thing is to be in a comfortable position and in a quiet space. This might be lying down or sitting in a comfortable chair. We just want to be in a nice relaxed state so that we can focus on our breathing and be present within the moment. There are a few different options, and it comes down to how your brain works and what's going to help you be most relaxed. So some people don't like to focus on counting because they find this quite difficult, and they just want to switch their brain off and do some nice deep breathing. Or some people find that if they're not counting or they're not focusing on something or have an intention set, that their brain wanders and they might be focusing on what they're having for dinner next, or what they need to do, or what they should be doing or prioritizing instead of doing some breathing. So sometimes counting your breath in this instance or having an intention can help to refocus and make sure that you're getting into that state of relaxation. So option one is where we don't have to count our breath. So we're just focusing on that nice deep breathing and engaging the diaphragm. So for this option, again, we're laying in a nice comfortable position or sitting in a comfortable chair so that you can relax. And we're focusing on breathing in through your nose all the way down into your belly. So making sure that you're drawing your diaphragm down and filling your belly with air. Often, especially if we're in pain or stressed or our posture is a little bit more kyphotic, we tend to breathe a lot more through our chest. And this is using different muscles through the shoulders and through the pecs, and our diaphragm starts to become quite rigid. So these breathing exercises are looking to help to try and get that diaphragm moving a little bit more freely. So, as I said, we want to start by breathing in through your nose, filling up your belly with air. Once you've filled up your belly as much as you feel you can, we want to breathe out through your mouth, emptying your lungs completely. If you are a chest breather, you might want to place a hand on your chest and a hand on your belly to help you encourage or feel where you're breathing. So placing that hand onto your belly can give your brain that cue that you've got to breathe down into your belly and give that feedback as to whether or not you transition into that chest breathing again. So you would do this for about 2 to 3 minutes, or as long as you feel comfortable doing so. At the beginning, you might do a little bit shorter, and as you become more comfortable with it, you may transition into a longer period of time, maybe up to 5 minutes. Option 2 is where we focus on counting so that we stop our brain from wandering. So the overall process is the same. We want to make sure that we're breathing down into our belly and filling up that belly with air and then breathing all the way out, but it's the length of breath that we're counting. So to begin with, we take a nice deep breath in through the nose for a count of 4. So that deep breathing over a count of 4, drawing down into the belly. We hold that breath for 7 seconds. And then after that, we're exhaling through the mouth, emptying your lungs completely over a count of 8. So breathing in for 4, hold for 7, and then out for 8. Again, you do this for about 2 to 3 minutes or as long as you feel comfortable. You might find these times are a little bit too long for you or what you can comfortably manage. So you might reduce that count for the time being. So you might do more of a 4 seconds in, 4 seconds hold, 4 seconds out. But again, we're just doing what you feel comfortable with. And again, it's stopping that mind from wandering so we can get into that state of rest and digest. Yoga Nidra is the other option that you can do. It's also known as yogic sleep and can be done in a guided meditation. So this might be from YouTube videos, or it might be at your local yoga studio doing a yoga meditation where it is led by someone and can help, again, stop the mind from wandering, but you're not having to actively think about what you're doing. Yoga Nidra is encouraged for those people who are sleep deprived and can help improve your quality of sleep as it influences the certain types of brain waves. So if you are struggling with sleep or find it difficult to fall asleep, then Yoga Nidra can be a really good way to do this. So when we're doing this, we're laying down and we're making sure that the body is completely relaxed. So you might put a pillow behind your head, you might prop your knees up so that you're in a comfortable position. And then we want to scan your body to be mindful of the tension that might be within the body. So you might be clenching your jaw, you might be clenching your fist. So be mindful of that and actively try and reduce those. From there, you want to set a intention or a personal declaration of fact. So this is not a goal. It's not something that you want to be. It's something that you are. So for example, it might be, I am present in every moment, or I have a kind heart. And this is something that you can then refocus on if you find your mind wandering. So we refocus on that breath, we let go of any thoughts, feelings, or images within the head, and we focus again on that diaphragmatic breathing, falling into that deep state of rest, and again, repeating that intention that you set at the beginning to help to refocus you. So diaphragmatic breathing can also assist with reducing pelvic floor overactivity and tension within the pelvis, which can lead to that pelvic pain. This is because there's a relationship between the diaphragm and the pelvic floor. So they act like a piston and they rise and fall together. So if your diaphragm is really rigid because you're chest breathing, you're not breathing down into your belly, then we're creating tension through the pelvic floor and then creating potentially some pelvic spasms, and vice versa. So if we can focus on our breathing, it can also help to relax our pelvic floor. And as I said, it's a really simple way to gain some really positive benefits without feeling like you've got to put yourself in a position that you're not comfortable to do so. So I hope these 3 tips have helped you. And if you are getting stuck because of any issues that are arising because of your endometriosis, then reflect back on these 3 tips, making sure that you're working within your limits, incorporating some stretching and some breathing into your routine, and hopefully it can help to improve and support your pelvic health.